Hello, good morning. My name is Sharmina Ahmed. My student ID is S333757. Today, I am going to talk about this presentation titled Analyzing the Strengths and Limitations of Nonverbal Communications in Health and Social Care. In this presentation, I will critically explore how nonverbal communication works, why it is essential in health and social care, and how it links to person-centered care and multidisciplinary teamwork. I will also reflect in my own practice and identify areas for improvement. In this slide, I am going to talk about what is non-verbal communication. Non-verbal communication is how we communicate without speaking. It includes things like facial expressions, eye contact, body language, gestures, tone of voice, touch, and even silence. These signals can often express feelings and emotions more clearly than words. According to Albert Mehrabian, 2017, nonverbal communication often carries more emotional meaning than what is actually said, especially when sensitive situations in health and social care. Non-verbal communication is very important because many patients rely on these cues to understand and feel reassured. This is particularly true for people who are anxious, unwell, and have difficulties communicating verbally. In this slide, I am going to talk about the strengths of nonverbal communication. Nonverbal communication is a valuable part of health and social care because it helps people feel understood and supported. Simple actions like smiling, making eye contact, using open body language, and speaking in a calm, friendly tone can help build trust and make patients feel more comfortable. It is especially useful for people who have difficulty communicating with words, such as those living with dementia, learning disabilities, or language barriers. Nonverbal communication also helps healthcare professionals show empathy and compassion. Agan 2018 states that positive nonverbal behaviors can strengthen relationships between healthcare workers and patients. In addition, paying attention to body language and facial expressions can help staff notice when someone is in pain, frightened, or confused, even if they are unable to say so. This allows care to be more responsive and focus on the individual's needs. In this slide, I am going to talk about limitations and risks of nonverbal communication. While nonverbal communication is an important part of feature of healthcare sector, it does have some drawbacks. So one of the biggest challenges is that people easily be misunderstood on non-verbal signals. For example, avoiding eye contact may be seen as a sign of anxiety or dishonesty in some cultures, but in others it is a way of showing respect. Body language can also give patients the wrong impressions. For example, if a healthcare professional seems rushed, stands too far away, or keeps their arms folded, the patients may feel that they are not able to being listened to or valued. Silverman et al. 2016 point out that nonverbal communication is influenced by person's culture, past experiences, and emotions, so that the same behavior can be interpreted in different ways. It is also important to remember that nonverbal communication cannot replace clear spoken communication. When explaining treatments, gaining consent, or discussing safeguarding issues, healthcare professionals need to use clear verbal communication to make sure that patients fully understand what is being said. In this slide, I am going to talk about the application in health and social care to meet learning outcome two. So to me, learning outcome two, healthcare professionals should adapt their non-verbal communication to suit the needs of each patient and the situation they are in. For example, using gentle eye contact, a calm tone of voice, a relaxed body language can help reassure someone who is feeling anxious. Likewise, moving more slowly and giving clear, supportive gestures can help patients who are confused or frightened and feel more uncomfortable. Sometimes saying nothing at all can also be helpful. Giving a patient a few moments of silence allows them time to think, process, process their emotions, or respond without feeling rushed. According to NICE 2021, communication should always be tailored to meet each of this person's emotional, cultural, and individual needs. By adapting the way they communicate, healthcare professionals can build trust, improve patient experiences, and provide safe, compassionate, person centered care. In this slide, I am going to talk about person centered care and nonverbal communication. This focuses on putting the patient at the center of the care. Non-verbal communication is a big part of this because it helps healthcare professionals understand how a person is really feeling, even if they do not say it out loud. For example, a patient might tell you they are fine, but the facial expression, body language, or the way they are sitting could just suggest that they are actually in pain or worried or uncomfortable or anxious. By paying attention to these nonverbal signs, healthcare professionals can respond in a way that better meets the patient's needs and helps them feel listened to and supported and feel wanted. Rogers 2012 explains that showing empathy and being fully present are at the heart of a person-centered care, and that these qualities are often communicated through actions, expressions, and body language rather than words alone. In this slide, I am going to talk about collaboration and MTD working. This focuses on the importance of working well with others as part of a healthcare team. Nonverbal communication plays a key role in helping professionals build positive working relationships. Simple behaviors such as maintaining good posture, listening carefully, making appropriate eye contact, and using a respectful tone of voice show that you are engaged and valued what others have to say. During handovers and team meetings, these nonverbal cues help create trust, encourage clear communication, and support effective teamwork. The NMC 2018 code highlights the importance of communicating respectfully to ensure safe and high quality care. On the other hand, negative body language, such as looking distracted, avoiding eye contact, or appearing defensive, can easily lead to misunderstandings, reduce trust, and create tension within the team. In this slide, I am going to talk about an example used in critical reflection practice. So I would like to share a reflective example from practice. I supported a patient with dementia who became distressed during personal care. They were confused and frightened. I used a calm tone, slow movements, and gentle touch to reassure them. I also maintained soft eye contact and gave them time to process what was happening. These nonverbal strategies helped reduce their anxiety and they became more cooperative. However, I realized that at the start I stood too close to them, which increased their fear. Wood 1997 emphasizes the importance of nonverbal reassurance in dementia care, and that this experience helped me understand how small adjustments can make a big difference. In this slide, I'm going to talk about my how I can improve my nonverbal communication. So there are several simple ways I can keep improving my nonverbal communication. One of the main things I want to focus on is becoming more aware of difficult cultures so I can understand that things like eye contact, gestures, and personal space can mean different things to different people. I also want to be more mindful of how I can come across more myself, especially with my facial expressions, tone of voice, and pace, particularly when things are busy or stressful. On top of that, I will try to pay closer attention to patients' body language so I can understand how they are feeling and think about how my own behavior might be affecting them. I also plan to ask colleagues for feedbacks so I can keep learning and improving. Skills for Care 2020 reminds us that reflecting on our practice is an important part of developing as a professional. In this slide, I will talk about this conclusion of this presentation. In conclusion, nonverbal communication is an important part of our care we provide every day. Simple things like our facial expressions, body language, tone of voice, and eye contact can have a big impact on how patients feel. When used well, these nonverbal cues help build trust, make patients feel valued, and support person-centered care. Although there are times when nonverbal communications can be misunderstood, especially because of cultural differences or personal experiences, these challenges can be reduced by reflecting on our practice and continuing to develop our communication skills. Overall, effective nonverbal communication helps improve the patient's experience. It strengthens teamwork and plays a key role in delivering a safe, compassionate, and high quality care service. Thank you for listening.